when you're a nurse, when you're in healthcare, you're dealing with other human beings. And your right to share what you do at work stops where it involves the other person, any other person.
You'll be doing things you don't like doing in order to go on living, that is, to go on doing things you don't like doing, which is stupid. Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
Hey! Yeah. Moving forward. All right, ladies. So this one touches close to home, all right? Because you know both Adrianne and I, we put a whole lot of content out there. But let me tell you the details, and then we'll talk about how we feel about it, all right? So nurses and doctors are flocking to TikTok. If you ain't got a TikTok, where are you? It's 2020, all right? Nurses and doctors are flocking to TikTok to crack jokes and lip sync, but are they eroding patients' trust? That is the question. So let me tell you a very specific incident for two healthcare-themed TikToks that have gone viral as of late have been widely derided. A now deleted clip from a user named Nurse Holly, and in the post-production, I'll show you a video of what Nurse Holly did, was widely criticized this month for stating that abstinence is the best form of STI prevention. And then before that, a nurse who goes by D Rose on TikTok, who mocked patients for faking their symptoms, accidentally kicked off a hashtag movement that led to thousands of users, patients, to share their moments when the medical providers didn't believe them. And I just want to give you a little insight of what some people in the medical field feel about this kind of story and feel about nurses and healthcare professionals putting this kind of stuff out there on the internet. Dr. Matthew Burke, who is a neurologist at the University of Toronto, and has written about the dissolution of patient-physician trust, said flippant clips about healthcare made and shared by healthcare professionals are emblematic of a broader issue within medicine. Adrianne, I love that I have you on here and I don't just have another nurse. Just like a random nurse. I wanted, it's a good thing that I have someone on that does put stuff out there on the internet, content about nursing, about patients, about healthcare. How do you feel about this? Because I feel like it could be a slippery slope, but at the same time,
it is.
At the same time, it's HIPAA. It's patient. I mean, you're a nurse. That's your job. This is what you're supposed to do. How do you feel? How do you feel about this?
So first of all, this is why I don't do live content. This is why I don't do live streams, because I want to make sure that my episodes and my content is so squeaky clean of anything that could be a HIPAA violation. And things you might not even think of as HIPAA violations are. And I have the benefit of the fact that I've worked in healthcare for a very long time. So a lot of the stories that I'm telling are things that happened anywhere from 2 to 14 years ago. And so you have to be impeccable with it. Yes. So that's the first thing I'll say, is that with HIPAA, you can't fuck around, because it can have real consequences for people. Even, recently I, have thought about how on my unit, we have patients that, we see people with long-term lung illnesses, and we also do end-of-life care. So we unfortunately get the truly the honor of taking care of people that we've known for years as they're dying. And so then after these people pass away, we have all these nurses sharing obituaries online and saying oh, I loved this person. Well, you're a nurse and you're posting an obituary of someone who recently died, and the obituary says they died at your hospital. That becomes very messy. So there are all these instances where people are just oh, I'll just share this because I cared about this person. So we have to be really immaculate with this. So when I edit my episodes, I'm making sure that if there's anything that could potentially link to a patient, even if it's something really benign, oh, they're from New South Wales.
Yeah.
Well, that's not common in Iowa. So if even saying something like that can be a huge violation.
Yeah.
And if somebody complains, they're going to drag you into that office. Like I once, it ended up okay. And I learned a huge lesson from it. But once I posted something on Facebook where I like almost violated HIPAA, and one of the nurses that I worked with, which I don't have hard feelings for her, she did the right thing, turned me in for posting something that she thought was a HIPAA violation. And fortunately, I had the foresight to go through and, you know, erase all of these things because people had said like, you probably shouldn't have done that. But that next day I was called into HR and they made me pull up my Facebook profile. They said, we want to see. And so you have to remember that at any point you have to be proud of the content you're putting out and be willing to sit down in HR and say, yeah, here's my website. The other thing I want to say just briefly about this, because I could get long-winded about this also, is that when it comes to like, you know, the nurse that was on TikTok that was like trying to joke on the fact that like patients, like we can tell when you're faking or whatever. First of all, when I make jokes or like we laugh about things like pet peeves, my top pet peeves about nursing, most of my top pet peeves, they're not directed at patients. It's like situational. You know, it's like when you're cleaning up poop and then you put clean linens down and then they immediately poop again. I don't care who you are. That's kind of fucked up and kind of funny.
Yes.
But I'm not like making fun of like people who have certain illnesses or like you know, there are so many autoimmune disorders and so many patients that don't get treated properly because nobody believes them or people dismiss their symptoms. It's a huge problem in healthcare. And so for us to joke around about that, I think is just a little bit too touchy. And with Nurse Holly, who I was following, like I was watching her shit and some of her stuff did kind of piss me off. Some of it's kind of funny, but we need to be really careful. Like, are we making fun of situations? Are we making fun of things that need to be improved? Are we doing this with a spirit of advocacy? Because like, even though I laugh about what, you know, stupid shit that I have to do for nursing, like messes I clean up or like weird things that you would never think of nurses having to deal with. But at the end of the show or the end of whatever I'm doing, I remember to say, even though I laugh about all this stuff, I would never trade my job for a million years.
Yes.
And you have to have a sense of humor about it. But when you start hitting people where it hurts, like people that, especially I think it's Black women are the most likely to be not believed about their symptoms. And we also know that women suffer from things like at one point fibromyalgia. I mean, still to this day, people are like, fibromyalgia?
I'm sure.
Sure. Mm-hmm. But people don't realize that like chronic pain, we don't know everything about the body.
Yeah.
And so to make jokes about this borders on inappropriate for me.
Most
third
Hit
thing
me.
is that I'm just laying it all out for you. Filming in the hospital or in your facility where you work. This is also a very dangerous and slippery slope. I do this, but I also feel confident that if my supervisor or my nurse manager and I were to sit down and go through all of my content, you do not see a face of a person in the hospital. You do not see a license plate. You do not see signage about what clinics I'm in. You do not see me, like I'm doing this shit like, first of all, your patients always come first. I don't care if you're on the internet, like I work night shift. If the unit is clean, your patients are cared for, everything that you could possibly do to have tasks done that are on your responsibility. Sometimes you have downtime. Sometimes your time management is really good. If I go into the break room and I want to record a clip for 30 seconds, I'm confident that I can, if my nurse manager were to say, hey, I just saw that you were recording in that empty patient room, like, what's the deal? I'd be like, well, my patients are asleep. My meds are given. The unit is clean. My pod mates are all good. Nobody needs any help. Snuck in here and now I'm back to work. So your hospital, you need to know your hospital's policy. My hospital has a policy that says like, post at your own risk. There's not really tight guidelines, but also on the other hand, I follow guidelines where I don't make friends with patients on Facebook. If they want to follow my public profiles, like on Insta, that's cool. And they do. And they send me messages. Like I'll make a joke about something and they'll be like, hey, I remember something like that happened to me once and it was really funny. So I know that I'm connecting with people on an appropriate level, but you constantly have to be evaluating your content. And that is all I'll say. Sorry, that's my soapbox.
No. And I think this is good because I did want to show the folks and you the actual video specifically. And I agree with a lot of what you're saying. And I'll talk a little bit about how I feel specifically after we just watch these couple of videos,
Sure.
because I think it's important that we do this. Okay. So
There
you
it
can
is.
see the screen.
I can see Holly. Yeah.
All right, word. So this is the video of Nurse Holly, and I just said, she said, abstinence solely is the way to go. Just the truth. So that's it. I mean, if you guys don't have TikTok, I don't know what you're doing, but TikTok is very like it's very, very, very short clips. And for those who are listening to the podcast version of this, it's literally Holly in Nurse Holly. She's in her scrub. She has a stethoscope on, and there's like word bubbles up, and it literally says the best way to prevent STDs is waiting till marriage. That is it. Okay. So I have a couple of feelings about this. Look, I think TikTok is very much, if you guys remember what Vine was, TikTok is very much like Vine. Like the goal of TikTok is comedy. The goal of TikTok is like really quick clips, funny, like lip syncing, dancing videos, like just like all of these really quick memes. It's like heavy on memes. And you want to be funny. And if a patient were to sit at a nurse's station and listen to the kind of shit we say, oh my God, right? All of us would be screwed. All of us would be screwed. But that's in the culture of working in a hospital. That's when you're at the nurse's station. That's when you're around other nurses that are in the units of like, it's very, very different. When you decide to take something out of the hospital, when you decide to do this on your own time, when you're not a nurse, when you decide to make it public, and not just public like putting a poster down at town hall, but make it public where it's on the internet, where everyone and their mother can see for the rest of time, that changes everything, right? That does change everything. And this, like, I have to be honest. I gotta be honest. This really made me look twice at the stuff I put out there. Adrianne, I feel like you had like a really good policy about what you decide to post, what you choose not to post, how you don't like to go live, and all of this stuff. And I think that's probably the best practice, especially when you're in healthcare. Because look, ladies and gentlemen, it is okay. I'm not gonna downplay any of this. TikTok is a great place. If you're a healthcare professional and you want to make jokes about what you do at work, you've got it. It's just it's a part of life. But being a nurse is very different than being an engineer. When you're an engineer, you're dealing with machines, mechanics. You're dealing with things that like just things. When you're a nurse, when you're in healthcare, you're dealing with other human beings. And your right to share what you do at work stops where it involves the other person, any other person. So, Adrianne, I really, really appreciate what you said about how you go about dealing with posting stuff and putting anything out there. Look, I don't think that either of those nurses should get like horribly punished, lose their jobs or anything like that, but they really do need to sit down in a conversation and just to rethink what they put out there, because just seeing what happened to them made me rethink what I should be putting out there, the things I should be saying and what I should be sharing.
And you do have to think about how would you feel if, you're a patient and then your nurse walks in and you're like, oh shit, it's that nurse from TikTok.
Right.
And you already know that they think that everybody's full of shit about their pain. Here's the thing. The other thing I'll say about that is the joke or the TikTok about like, oh, I'm allergic to Tylenol and all this other like, non-narc medications.
Yep.
But Dilaudid works. Here's the thing. There are a couple things I want to say about this. Yeah, we do see drug seekers, but to assume that everyone that needs high dose pain medicine is a drug seeker is not always the right way to approach it, because, if I come in and I've had a chronic condition for 20 years and I know that taking Tylenol doesn't do shit for my pain, and I want to bypass the hours of waiting for the Tylenol to be proven ineffective, and I know what I want. But then people say things like, if you say, well, I know Tylenol doesn't work, can we go to the second? Because according to like governing bodies and regulatory bodies with pain medication, doctors have to, at least in my hospital, I don't know how it is elsewhere, I assume this is like a widespread thing, but we have to label medication as first line, second line, third line, which basically says that you have to try So say Tylenol is usually first, and then like, half a oxycodone or Lortab or something is second, and then third we go to Dilaudid, which is the big gun. Well, you have to usually, even if I know my patient is in so much pain that Tylenol is not going to do shit, I have to justify why I didn't do the first line, second line medications.
Yeah.
So as nurses, we need to really evaluate this carefully because there is an opioid epidemic. People are addicted to drugs. These are highly addictive. And also when you have to back off these pain medications, it becomes really difficult to get out of the hospital because you need so much pain meds. We can't let you leave just walking around with like buckets of Dilaudid that you need to control your pain. It's a multifaceted issue, but like when we're talking about joking about people being in pain, it's a hot button topic,
It really is.
like you have to know your audience. And if you have a patient that knows that Tylenol is going to just leave them sitting here in the same amount of pain. The other thing is that people don't understand what an allergy is.
Right.
And this is really down to medical literacy.
Yes.
Healthcare literacy. Like when someone says to you, I'm allergic to Tylenol, well, maybe they're just bullshitting you and they're trying to tell you that they're allergic to Tylenol, but they'll take their Lortab, which has Tylenol in it, and they don't know. Sometimes it's because they're trying to get you to give them a higher dose or something like that. But oftentimes people just don't know what an allergy is. That's true.
And just to back up, to reiterate what you just said, it's super important because, if you're a nurse, if you're a healthcare provider, you have heard that joke, specifically that joke about, only Dilaudid works. And we all know why people say that. And yes, it is. You do have those patients that come through like frequently and they ask for specifically Dilaudid, and you do see they are seekers, right? But when you do carry that and say that's the majority of patients, that's a problem. But on top of that, we have to understand as healthcare providers that a lot of these opioid epidemic patients, victims, bodies are because they start out by getting some of these narcotics at the hospital. So it is a very hard thing to balance.
You have to be careful.
You really do have to be careful. But joking about it, it's a touchy subject.
Poor form.
Yeah, it's a touchy subject and it's hard, right?
And really, I think, you have to come down to it. How would you feel if every patient you take care of from now until the end of your career knows that you said this stuff on the internet and that's how you feel? That's why I really try to stay away from talking about politics anywhere online, especially in my public nursing uncensored life.
Yes.
Not because I don't have strong convictions or not because I don't want to use my influence for whatever good it can be, but more so because I don't want one of my patients to ever think that I'm going to treat them differently because I know something about what we believe is different.
Yeah.
I don't want that to ever be a factor. So
I'm gonna touch upon that towards at the end of nursing news. For those who are listening, please stick around because I do want to have a thorough conversation about that and legitimately that topic about how much it is okay to share and how does that affect your patient care. I do want to talk to you about that at the end, Adrianne. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.